Have you ever realized that sometimes we can spend hundreds or like thousands of dollars on like skincare product, hair product, but we often neglect our feet, which are so important and carry us over all day long.
It's about time that we start taking care of our feet. And we decided to do this video because our patients ask us all the time how to do foot care at home. Some patients are scared to go to pedicures, risk of having infection or getting ingrown toenails. So today we're giving you our healthy foot care routine that you can do at home.
Let's go.
Hi, I'm Dr. Richard.
And I'm Dr. Blanchette.
We're board certified podiatrists and foot and ankle surgeons. And today we're sharing with you our curated foot care routine.
We're gonna go from everywhere to how to wash your feet properly, if you should soak them or not, how to take care of calluses, your toenails, how to moisturize your feet, and even discuss some nail polish that you can use to make your feet pretty for the summer. If you're new here, welcome. Every week we share evidence-based medicine to keep your feet healthy and pain-free. We also often share products that we really like and that our patients have tried and like as well. So if you're interested in learning about all of that, make sure you subscribe to the channel.
Important disclaimer, safety first. To do a foot care routine at home is not for everyone. There are some patients that have decreased sensation in their feet. We call that peripheral neuropathy. If you feel a little bit of numbness in your feet, we do not recommend for you to do this at home.
Some people that can have that are, for example, diabetics. They also can have decreased circulation. If you get a cut while you're cutting your nails, it can not heal and cause a big problem. For patients like that, we recommend you to see a podiatrist to have proper evaluation of your feet and to maybe even shave the calluses and cut your toenails if you qualify for that. If you have any questions about diabetic foot care, just look at this video over here. We go over everything why diabetic foot care is just so important. Step 1, wash your feet.
Let's start with the basic. We need to have clean feet before we start a foot care. But let's be honest, most people, when they take a shower, they forget their feet. They wash everything and they stop at their lower leg. Just having soap running down to your feet is not enough. This is what I do. I use my daily gentle body cleanser, like this one. And I use the soap, I clean on the top, bottom, but also in between the toes. And after that, I rinse everything out.
You can do like Dr. Richard and just use your regular body wash and just use it on your feet as well. But if you're noticing some odor on your feet, sometimes you might have a buildup of bacteria. So to actually use an antibacterial soap can be helpful. We like this Panoxyl soap because it contains benzoyl peroxide, which is an antibacterial. It's gonna help to eliminate the odor causing bacteria that can be found on your feet.
Step 2, foot soak.
Foot soaking can be very beneficial because it can help to soften the dead skin, soften the nails, so it's easier after that to go and take care of the calluses and also trim the toenails. There's a few things that we need to keep in mind though. You don't want to soak for too long because if you soak for too long, it might strip the oil on your skin and cause more dry skin.
The recommended amount of time to soak your feet is between 10 to 15 minutes. It should be done in lukewarm water. It should not be in like warm, hot water that can cause burn, but also same thing, strip the natural oils which protect your skin.
If you want to be fancy, you can even buy yourself a nice foot bath like this one. It comes in, makes little bubbles. There's even little foot rollers that you can use to massage your feet as you're soaking your feet. So this one is very fancy. It even has temperature adjustment to keep your feet nice and cozy during your foot bath.
If you like to make your foot soak more relaxing, you can even add Epsom salt, which is magnesium sulfate. And a lot of people finding very soothing. It decreases soreness after a long day on your feet, and it can also decrease inflammation.
There's even some brands that have some essential oils inside, so there's a nice aromatherapy at the same time just to relax you even more. Sounds so nice right about now.
Can we do that as we're filming?
I know, right?
After 10 to 15 minutes, once you're done with your foot soak, take a clean towel and dry your feet. Do not forget in between the toes, that's where the moisture stays.
It's very important because if you have moisture that stays between your toes, it's a perfect breeding ground for fungus, which like warm, humidity, and dark. So make sure you dry well between those toes. Step 3, callus care.
After the soak, your skin is gonna be softened, so it's the perfect time to take care of the callus. And we recommend at home to use a gentle glass pumice stone like this one to rub gently on the area of thickened skin to decrease the thickness.
A callus is a thickened skin area that is caused by pressure and friction. If you realize that some of them always come back, sometimes you can also have an abnormal biomechanic, which is causing always the same type of callus. So to go see a podiatrist might be a really good idea to figure out why this is happening. And if your callus looks like this one, that one, or even you have cracked heels like this, make sure you go see this playlist. We went in detail about all of those calluses and corns, and we discussed the root cause, how to treat the root cause, and also how to treat those calluses.
If you have really painful callus or they are really deep, like you have a deep corn, sometimes just to do it at-home foot care is not gonna be enough. We recommend you to go see a podiatrist because they can use a scalpel to remove that core and shave it down to improve your symptoms.
Important disclaimer, please do not try to use a razor blade at home. Scalpels are very sharp. You can cut yourself, which can cause a wound, a portal of entry for bacteria, which increases the risk of infection. It's a big no-no. And also, it's really hard to do it on your own. You know, like you're all bent out of place and then trying to shave your calluses. Please don't do it. Just go see the podiatrist.
Another thing that we do not recommend for you to do at home is to use salicylic acid patches. So those patches, yes, they decrease the buildup of callus, but they do not distinguish between good or bad skin. They stay on your foot for hours, they move around. I've seen a lot of patients coming to the office with chemical burns from those patches, and also it's not really aesthetically pleasing. The skin will become really white and macerated.
We are also not really in love with chemical foot peels. The idea sounds interesting, right? You put this thing on your feet and then after that the skin starts peeling, so then it removes as like thick calluses. But the problem is that the product goes everywhere on the foot. So let's say if you have an issue on the side of your toe, around your heel, but you have normal skin in your arch, well, everything is included in that foot peel. So you're gonna start peeling from everywhere. And also usually you're gonna continue to peel for about like a week or so. So it's not really aesthetically pleasing either. Instead, it's better to use appropriate product in spot treatment. And we'll go over our favorite one in step 7.
Step 4, nail care.
Now let's move on to your toenails. Toenails grow about 1 to 2 millimeters a month. So if you look at them and they seem a little bit long, so it's time to trim them. An important thing to do is to trim them straight across. Try not to go and dig them into the corner because that can cause ingrown toenail. One of the caveats with that, if your nails are very curved already, if you leave them straight across, it can cause a little point and that can be sensitive. So you could file them down gently in the corner, but don't go and do bathroom surgeries, please.
Exact. Don't be too aggressive in the corner. Just follow your natural nail curve. The rule of thumb for the length of your toenail: when you touch the tip of the toe, you should feel the pulp and not your nail. Having a nail that is too long will cause repetitive trauma at the end of your shoe, and a nail that is too short can also dig and cause an ingrown.
We recommend you to get one of those pedicure kits here. It has everything you need in there. Some different nail clippers, so you can have one for your hands, one for your feet. There's also nail files in them, and also some cuticle pusher, which we'll talk about that in the next step, what to do with your cuticles. If your nails are really curved and you tend to get ingrown nail and you have to go and clean them up a little bit in the corner, not aggressively, again, this might be easier to do with those type of nail clippers. If you tend to get ingrown nail repetitively, please go see this place over here. We went through everything about ingrown toenails, including some conservative treatment versus surgical treatment to take care of those pesky ingrown nails.
If you have a lot of difficulty cutting your own toenails, if they are too thick, too brittle, or even if you notice that they change in color, it might be a fungal infection. So you can see our playlist on fungal toenails to know if it might be something that you have.
Step 5, cuticle care.
Cuticles are there for a reason. It's a protective seal, so there's no bacteria, no fungus that goes around your nail plate, but also the matrix, which are the cells at the base of your nail that produce your nail plate. So it's very important to keep this seal intact.
You might not always like the way they look. They can look dry and then sometimes peel a little bit. So it's better to actually take care of them, moisturize them. We'll go over that in a minute. But also, whenever you're doing your care, now that your feet have been soaked, your cuticles are going to be nice and moisturized. So you could push them gently, but you should never push them enough so that your cuticle is not in contact with your nail anymore. And please don't try to cut them with scissors or with nail clippers. They are there for a reason. They are there to protect your nails.
To make your cuticles look better, you can use the C&D Solar Oil. It contains jojoba oil, vitamin E, and other natural ingredients that's gonna moisturize your cuticles. But if you want to apply nail polish within your foot care routine, of course, you're gonna have to apply the cuticle oil once your nail polish is dry. So it's gonna be one of the last steps. Step 6, nail polish.
So this last step is optional, but a lot of women during the summer especially, they like to have their nails painted because it makes them look pretty and feel good about their feet, and especially ready for sandal season. A lot of the regular nail polish have a lot of chemicals which can be harsh on the nails and on the skin. So we're gonna share with you the favorite nail polish that we like that are free of most chemicals.
Our first one is Dr. Remedy nail polish, and this one was formulated by Podiatrist, so it's free of harsh chemical, and it also contains a lot of natural products that helps the nail. First of all, it has tea tree oil, which has a natural antiseptic and antifungal properties. Next, it has garlic extract, which is also an antimicrobial agent, and also biotin, vitamin B7, which help with nail strength and growth. Additionally, it has different type of vitamins like vitamin C, vitamin E, and wheat protein, which helps with shine. But if you have celiac disease, I would avoid using this nail polish.
I actually have celiac disease, and this is the reason why I don't use Dr. Remedy. So usually it's the same nail polish that I use for my toenails and to my fingernails. So I wouldn't want to have any cross-contamination while I'm eating and having the nail polish touch around my mouth. The next one that we like is Nanny Pro. This is actually what I'm wearing right now. It is also doctor formulated. It is a toxin-free nail polish, and it contains undecyanic acid. It's a natural and proven antifungal, which can help to decrease the chance of fungus on your nails. I wouldn't use that to treat current fungus though. If you think you have fungus, you should go to the podiatrist to get a proper evaluation, but it can help as prevention. It also has biotin, vitamin A, vitamin E, which help to grow, hydrate, and strengthen the nails.
If you want a nail polish that dries quickly, we recommend the Dazzle Dry. It dries in 5 minutes, and it's also free of 14 chemicals.
Something important to note is we don't want you to leave the nail polish on for too long. When it starts to chip or it starts to grow out and it doesn't look as good anymore, you should remove it. Don't just wait for it to completely come off on its own, because it damages the nail at the same time when it stays there for too long. We also usually recommend you to use them during the summer when your toes are out and then you have sandal season, but we always recommend to give your toenails a break during the winter, so then to let them breathe, go nail polish free during the winter.
I tell my patient to keep the nail polish on for a specific event, for a specific vacation, 1 or 2 weeks, and then remove it. Make sure to inspect and there's no abnormality of your nail plate before reapplying a new coat. And to remove the nail polish, we recommend an acetone-free nail polish remover like this one. Yeah, because acetone can really be harsh on your skin and cause a lot of dryness.
Step 7, Callus products.
Okay, let's go into the Callus products that we recommend. And those products we're gonna use to do spot treatment. So specifically in the area where you have callus. The Kerastyle Intense Foot Repair Cream is a 3-in-1. It has salicylic acid, which decreases the buildup of callus, urea, which is also a keratolytic agent, decreases the buildup, but it also hydrates the skin, and then petroleum jelly, which is an occlusive and locks the moisture in.
If you try this and you still have pretty thick calluses, you can also add before all of that this urea stick. It's 60%. You put it directly on spot treatment where you have those thick calluses and then finish with the cream we just talked about. It's gonna help to slow down the buildup of callus.
Now that you have your callus taken care of, let's lock everything in with a good moisturizer.
Step 8, moisturizer.
There are so many different moisturizing cream and they all have different benefits. So depending on what you actually need, choose the one that works for you and use it daily. Let's go over the ones that we prefer.
Many of my patients think they have good creams at home. They say they have multiple different creams, Aveeno, CeraVe. But if it's a body lotion, it's not strong enough for the feet. Feet have much thicker skin and they need some particular ingredients to go through that thick skin and then be able to help the skin better. Oki's Healthy Feet. It has glycerin, which is a humectant, and it's gonna draw and attract the moisture, keep it close to the skin. Also allantoin, which helps to soften up the rough skin. Stearic acid and paraffin, which help to lock everything in.
We also like amlactin foot repair cream, which have an active ingredient. It's lactic acid 15%, which gently exfoliate the rough skin and also help with callus. They have a proprietary blend that helps lose the moisture and a lot of ingredients like glycerin, which is a great humectant, and petroleum, which is an occlusive layer that's gonna keep everything close to your skin.
Other products that we like for cracked skin are Skintegra. Skintegra have both lotion and cream. They have a rapid crack repair cream that works really well. It has bio-identical skin lipids, which are proven to go inside the skin and repair the skin barrier, which really helps and it works really, really well. They also have other active ingredients like urea, for example.
If your skin is extra dry, the last step, you can always put petroleum jelly or Vaseline. And now that you have so many layers of active ingredient on your skin, you're gonna slip everywhere. So make sure you wear silicone socks. So you put those on and then you go to sleep. You're gonna have a good 7-8 hours of those active ingredients doing their magic. But realistic expectation, it's not magic. You actually need to put those on every single day. Some patients see results within a week. Sometimes it can be a little longer.
And please remember, if you're doing all of this, using all of those good cream and you still have dry skin despite that, you might not just have dry skin. You can have fungus or even psoriasis, and those creams might not work for you. So if your dry skin doesn't get better after all of this, make sure you go see your podiatrist. Okay, that's a wrap. Today we went over a lot of things. We discussed about what's the proper way to clean your feet, to soak your feet. We also discussed about what to do with your calluses, how to cut your toenails. We discussed about the importance of cuticle and how to take care of them. We also talked about some nail polish that we recommend and ultimately some products that we like both for calluses and also dry skin.
As usual, you'll find those products linked below. We really hope this helped you. We want you to have cute, but most importantly, healthy feet. And now you know how to do a podiatrist-approved foot care at home.
If you remove your nail polish and your nail looks like this, maybe it's time to watch this playlist here. We go in detail over a lot of different things that can happen with toenail, from fungus to actually not fungus things. And we also talk about when you should go see the podiatrist. Okay, see you next week.
Bye.